welcome back to this last video on the urinary system or the renal system. And in this one, we're going to be looking at the microscopic anatomy of the kidney. So we're going to start with something we already know, the afferent arteriole. So this was the arteriole coming off the cortical radiate artery, and it's going to be bringing blood flow into the functional unit of the kidney, which is the nephron. And so the nephron has some components. It has some tubular components, draining fluid, and it also has this big tennis ball structure. One way to tell the afferent arteriole from the efferent arteriole in this type of model, for instance, where you don't have a cortical radiate artery, is to look at the wall of the blood vessel. And in the afferent arteriole only, there are these specialized smooth muscle cells in the wall. And these cells are known as granular cells, and these have a distinct physiological purpose, which you'll learn about in lecture. Okay. This entire tennis ball structure is known as the renal corpuscle. So when you are looking, for instance, at this triangular model over here, any place where you have what just looks like a white tennis ball, that structure is called the renal corpuscle. Now, if you notice on a couple of these, that corpuscle has been cut into half. So if you're pointing at the other ones, or if we're pointing at the one on the right and just pointing at one thing, don't call it the renal corpuscle, because we are then asking what the name of what one of the structures that makes up the renal corpuscle is. So what are the two structures that make up the renal corpuscles? Well, the outer part, the part that would be like the yellow ball of the tennis ball, that is Bowman's capsule, also known as the glomerular capsule. Okay, so it is this outer part here where you can see these epithelial cells on it. So in a microscopic view of the kidney, it is this outer part right here where the arrow is, that will be Bowman's capsule. And then inside Bowman's capsule, you have a space, and inside the space, you have this tangle of blood vessels. So the space is known as the glomerular space, or known as Bowman's space. You can use either term, give you credit for either term. And then, as alluded to previously, the name of that tangle of blood vessels is the glomerulus. And this is the capillary bed that is not doing gas exchange. So it has an afferent arteriole with granular cells bringing blood into the glomerulus. And then on the glomerulus, it is covered with these specialized cells that have like all these little toe interdigitations, like fingers going together like this. And so those cells are called podocytes. Now on the models, they tend to only show podocytes on half of the glomerulus. So you can see the blood, the capillary on one side, and you can see the podocyte on the other side. So sometimes it's side by side, and sometimes it's superficial versus deep. But I want you to realize the entire glomerulus would be covered by these podocytes. All right, so what happens here is, let me go back to this slide. So what is going to happen is blood is going to enter the glomerulus, and then from the glomerulus and through the podocytes, part of the liquid is going to be filtered. That filtrate would then enter Bowman's space surrounding us. Okay, so what I want you to notice about this renal corpuscle is that both blood vessels are at one end, what's called the vascular pole. And at the other end, there is a tubular structure that is draining this space. And that tubular structure draining the space is known as the proximal convoluted tubule. So why does it have that name? It's called proximal because it's right next to the renal corpuscle. Why is it called convoluted? Because if you look at it, it's very squiggly, zigzag, back and forth all over the place. And so it squiggles, 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 and then it's going to drop down into the renal medulla, take a U-turn, come back up, and go back into the cortex. So only this part that's here in the cortex is called the proximal convoluted tubule. On this model, what you will notice is that it is a green tubule exiting one pole. Okay, and so like this one is showing here that we have blood vessels on the other end. This one's not even showing the blood vessels, but here is the tubular pole. So this is the proximal convoluted tubule. All right. Once the proximal convoluted tubule has gone into the renal medulla, it forms this U-shaped structure known as the nephron loop or the loop of Henle. Once again, either name is fine. And in the loop of Henle, we have something totally different being done on the side going down versus the side going up. And so we have names for the two sides. So the first portion, so as soon as you leave the proximal convoluted tubule, what you're actually entering is the descending limb of the loop of Henle. Now, it is not a descending loop of Henle. It is a descending limb of the loop of Henle. And so that's dipping down into the renal pyramid. And then at the deepest portion, way down there in the papilla of the renal pyramid, it then makes a U-turn and comes up as the ascending limb of the loop of Henle. And that is bringing whatever fluid is inside that tubule back up into the renal cortex, where now we have a very zigzaggy kind of tubule again, and that's called the distal convoluted tubule. So I want to point out what happens to the distal convoluted tubule on every single model. So let's start at the far right model. What you'll notice in this one, the distal convoluted tubule is going to be this brown thing, but notice it goes right next to the renal corpuscle, but not at the tubular pole, at the vascular pole. Go to the far left one, you can see the same thing. Here's the tubular pole with the proximal convoluted tubule. There's our loop of Henle. Come back up, our distal convoluted tubule is going back to the vascular pole. It's right there next to that afferent arteriole. The model in the middle, here's our tubular pole with the proximal convoluted tubule. At the other end, the vascular pole, we had our afferent arteriole, efferent arteriole, and now we have this lovely tubule there. So this must be the distal convoluted tubule because the proximal convoluted tubule is at the other pole. And the loop of Henle is not in the cortex. So this is our distal convoluted tubule. So when we look at the distal convoluted tubule, let me go back to this picture where I don't have anything blocking it. I want you to look at the epithelial cells. And on this side, you will notice that they are wider apart. And on this side, the side that is closer to the afferent arteriole, what you notice is they are more squished together. Okay. And so they have a higher density. And so that area of the distal convoluted tubule, which is just adjacent to the afferent arteriole, is called the macula densa. And so this is super important because there is a structure known as the juxtaglomerular apparatus, which means next to the glomerulus. And that's the stuff in this yellow oval. It includes the granular cells of the afferent arteriole and the macula densa of the distal convoluted tubule. Because what happens is 24/7, they are talking to each other. Blood pressure's a little, okay, I'll conserve some water, send it back into the bloodstream. Oh no, blood pressure is high. Okay, we'll pee out some more. And they are doing this 24/7, trying to keep your blood pressure and your blood volume in the normal range. And you'll learn a lot more about that in lecture and in physiology topics. All right, so where we had our urine was in the distal convoluted tubule, and the distal convoluted tubules then become like all these driveways which enter this main street known as the collecting duct. So it's collecting all the urine from multiple distal convoluted tubules. And yes, I know that's happening mostly out there in the cortex, and then that collecting duct travels through the medulla, and when it gets in the renal pyramid, and when it gets down to the papilla of the renal pyramid, it has a name change to the papillary duct. Because once it's the papillary duct, nothing more is going to happen as far as adding urine to it. And then from the papillary duct, it dumps into the minor calyx. And with that, we are done learning all about the urinary system. So I want to thank you once again for all your hard work, especially on the more difficult aspects of this. And I will see you again soon.